Hi everyone, this is Catherine with Del Sol Community Wellness, and today I wanted to hop on and just talk to you quickly about a technique that you can do at home for either yourself or your family as care for minor injuries. A lot of times, you can have just a minor sprain or just some sort of minor musculoskeletal issue, maybe at a joint, maybe not, that can be troublesome. It can cause you pain, you can have some stiffness, you may even have a little bit of swelling. Maybe not enough to take you to the doctor, but enough to be troublesome to you and bothersome, maybe start to hinder some of your activity. And a lot of you wonder, if it's not worth going to the doctor, is it maybe not worth coming in here? There actually are several things that you can do at home that are really simple. And one of them is using hydrotherapy, which is cold and hot. And so I want to talk to you about that. I know the conventional wisdom has always been that for injuries, you want to use ice. The old acronym RICE, R-I-C-E, rest, ice, compression, and elevation, right? Ice is really good. It actually is really good at stopping swelling. The way ice works is that it's a vasoconstrictor. And what that means is your vessels, so your blood vessels, the arteries and the veins, they actually have little muscles in them, and when cold is applied, they constrict. So that's why it stops the swelling, because it actually slows or even stops fluid from flowing into that area. And if there's no fluid coming in, then there's no swelling happening. And for a long time, injury treatment has always been ice, stop the swelling. Here's the problem. More conventional thinking today among a lot of practitioners is that ice is actually not something that we want to do. Yes, swelling can be bad if it goes on for a long period of time. A little bit of swelling in the beginning, that's actually how your body starts to heal the area. All of that fluid that's coming in, well, I suppose not all of it, but a lot of the fluid that's coming into that area is carrying things that your body needs to actually heal and repair whatever damage has been done. And therein lies the issue with the vasoconstriction. When we constrict, we've either slowed or even stopped fluid flowing into and out of that area, which means healing. The healing process has also slowed or stopped. So that's really the basis for why a lot of us have moved away from this idea of using ice. There is a time and a place for ice, but in general, I really don't advocate for the use of ice. Rather, we're better off if we use ice and heat together. So if ice is a vasoconstrictor, heat then is a vasodilator. So when you add heat, those muscles are going to open those blood vessels, and you're going to get a lot of fluid flowing in and out of an area. Heat on its own is sometimes just the ticket. It makes all the difference. But oftentimes what I find, especially when we're talking about minor injuries, the better thing is to use them together. And it's really simple to use them together. You start with ice and then follow with heat and repeat. So you would do 30 seconds of ice followed by 3 minutes of hot, and you repeat times 6. A lot of people will tell you to stop on cold so that everything is constricted and stopped. I'm not a fan of that. I'm a fan of ending on hot. So start with ice, follow with heat, repeat, and end on hot. So everything is open. If you have swelling already in that area, or even if you didn't have swelling, you may have the result of a little bit of swelling, especially when an injury or an issue is really acute, really on those early stages. And a little bit of swelling as a result of using this hot-cold pump is actually not something to worry about as long as it's pretty minor, not causing an increase in pain, and not really ballooning up and causing a huge area of swelling. But if it's pretty minor, you just see an increase, I don't worry about that. And I don't encourage you to worry about that either. It should be pretty brief. It shouldn't last for, weeks on end. But if that goes on for several days, that's okay. This hot cold pump thing, 6 cycles is the minimum that I recommend. And then you can repeat that several times during the day. 3, 4, 5, 6, 8 times a day, and really be flushing. So what's happening is you're causing constriction with the ice, and then with the heat causing dilation and flooding the area with nutrients and fresh blood and all the things that brings, all the healing agents that come with that, and then constriction and dilation, and you're creating this pump. You're flooding the area and pumping through it all the benefits of fresh blood and waste removal. It actually will accelerate you through the healing process. Anyone can do this at home. You can do this with your kids. You can do this with any of your family or friends. It's something you can do for yourself. If it's on a limb even, you can use a bucket of ice and a bucket of warm water. You can do paper cups, fill them with ice, put them in the freezer, tear off the bottom, and then use it as an ice wash, basically. For ice, you can use an ice pack. You can use a heating pad. You can use a rice pack. There's lots of different ways to get the hot and the cold. For, like I said, your kids, your families, yourself. This is one of my go-tos. I use it on myself. I definitely recommend it for my patients, and I see such wonderful results from using this technique. So if you or any of your family members if you ever have just a minor injury, a musculoskeletal injury, a sprain, a strain, step off a curb wrong, have an elbow or a wrist issue, maybe from overuse, maybe you carried something wrong, any number of things. It works anywhere. If you have more questions, or if you want to talk specifically about your circumstance, please give us a call. Our office number is 970-218-7179, and our email is hello@delsolcommunitywellness.com. I'd be happy to walk you through troubleshooting if you run into issues, and certainly if you want a consultation, we're here for that too. Don't feel like you're out there on your own. You definitely have resources here, but I just want to give this tip to you. It's very empowering. You can really take control of some healthcare at home and take care of your family without maybe struggling to find some resources. So that's my tip for today: minor injury care for home around minor musculoskeletal issues. So if the swelling gets out of control, or if this technique doesn't help within just a number of days, you probably do need some outside care. There are other things that we can do for you to help accelerate the healing process and get you well. You don't want an injury to linger. You don't want things to go on indefinitely. So the sooner you get on it, the better the result is going to be, the easier it is to fix. So definitely keep that in mind, but this would be something to try for the first couple days at home and see what kind of a result you get. So we're available if you have questions. Use that technique at home and let me know how it goes. Your success stories, I want to hear those too. So that's it for today. Thanks for listening. Talk to you soon.